Hi, my name is Michelle, and I'm talking about reusable learning objects, also known as RLOs. So what is it? An RLO is something that helps facilitate learning, can be used for peer education, it can be used for patient education. Really, anytime you need to be educating somebody, these are great options. We want to base them kind of towards one single learning objective, and we can make them either an electronic thing or a handout, kind of whatever works for the situation. They're also an option in formal and non-formal settings. You can use them on e-learning platforms or in independent web pages, that sort of thing. So when you're thinking about creating a reusable learning objective, what you need to do first is choose your topic. Then you would want to identify what your main objective is going to be and make sure that you specify that so that people know what this learning object is going to be used for. Next, you would want to outline your content. So think of what you need to say, how you're going to say it, that sort of thing. You want to keep in mind when you're doing this who your audience is going to be and who's going to benefit from this learning stuff. Next, you would want to create a script for yourself as the educator. You don't need to be showing this script to the learner. It's just kind of something for you to have, kind of keep with you while you're giving the presentation so you know what you're supposed to be saying and when. Specifically for like a PowerPoint presentation, you can make yourself notes in the notes section that nobody else has to see when the presentation's on the screen. Lastly, you would, of course, put the presentation together and give it. So these learning objects can kind of engage all of the learning domains. First one I'm going to talk about is the cognitive domain, which is your thinking domain. This domain kind of is used anytime you're learning new information. So like I said here, that anytime we're teaching people new information, we're using the cognitive domain by simply teaching them. We also expect from our teaching that the patient understands and can apply the information that we're giving them. So that's kind of something we need to make sure that we are checking that the patients do understand what we're saying. They can be used to supplement what the learner already knows or what the learner has already heard previously in either their hospital stay or their class they're taking or whatever the case may be. This can just kind of supplement or add to it, kind of wrap it up, that sort of thing. Just a different way for them to hear the information. I always think of a great way to use one of these as giving a patient a handout on their new diagnosis that they can just kind of read and look at whenever they need a refresher as to what's going on with them. So the affective domain is the next domain that I'll talk about here, and that's your feeling domain. So I always think of this one as kind of what's going to help the learner learn best. We want to kind of engage their emotions, their interests, their beliefs, that sort of thing. So if it's like somebody, for example, that doesn't watch television or that sort of thing, we need to make sure that it's going to be okay for them to watch a video. We don't want to say, okay, here's all these videos that you can watch, if it's not something that they're going to be interested in or value, because they just don't appreciate that kind of learning. Like I said there, you can find out their preferred way and try to supplement using that preferred way. So the psychomotor domain is your skills domain. Learning in this domain is more used when you're actually learning a new skill. So this can be used for a reusable learning objective. It just depends on what we're talking about. So if we're teaching a patient a new skill, like the example that's there on the screen about giving themselves an injection, this might be a great time to use a video that they can watch somebody give an injection and see exactly what they need to do there. Some pros to the reusable learning objectives would be that they can take them home. They can actually be reused. So like a handout can be reused, can be looked at later, that sort of thing. A video could be used for multiple different learners. These objects can be interactive. Like I said, they're portable in some cases. In some cases, if it's internet-based, you might even be able to get it on your phone, your tablet, that sort of thing. Videos are available on the internet, on the television, that sort of thing. So you have a couple different options of how to show them. Some cons would be that not all learners learn that way. Some people might want to open up a book and read it that way. They don't want to look at a flashy handout or watch a video or anything like that. Learners might not have access to the computer or to the internet to be able to watch some of the videos or to be able to do like an interactive website. They might not have the access to that. They also might not be able to read at the level of the information. So we need to make sure if we're the ones creating the document or even picking what we're going to give our patients, we need to make sure that it's something that they can read and understand. So that's something to ask your patients before you start the education. Kind of find out where they can understand reading at, and just kind of keep in mind that it's a struggle for some people to understand written information. Another con could be that the patient might not understand the language that we have it available in. For example, if we have a Spanish-speaking patient and we're giving them a handout that's in English, that's not going to be valuable for them. So if you're the one making the learning object, it would be great if it would be possible for it to be translated into other languages. It's not always possible, but ideally we could do that and kind of provide it in multiple different languages so that all of our learners are kind of covered with these supplemental education tools. So just a couple examples. I know I've kind of talked about a couple examples throughout the presentation already, but a PowerPoint with a voiceover talking about diabetes. Another one would be a combination of a video and a discussion to teach a patient how to test their blood sugar. So a video that actually shows somebody testing their blood sugar so that the patient can see exactly what they're supposed to be doing and not just hear what they're supposed to be doing. A presentation and a handout about a new policy for managing low blood sugars in a hospital setting. So this one would be more of like a peer education session. For example, if the policy changes that they want you to manage low blood sugars in a different way, this would be a good way for nurses and for staff to know what they're supposed to do and when they're supposed to do it by having a handout. Another thing that we could do is have a video about how to perform basic newborn care. I work out at Women's and Babies, and I know for a fact that we have a whole education channel for parents to watch if they want to, as like a supplement of everything that we tell them. They can watch videos on breastfeeding, they can watch videos on newborn care. There's a shaken baby video that we have them all watch so that they know how serious shaken baby syndrome can be. Everything like that is just kind of like a supplement to what we're already telling our patients, just a different way for them to see it. And lastly, you have my references, kind of where I got my information from, that sort of thing. Thanks for watching.